Evening, Littleton. Welcome to the April 24th, 2024 Board of Health meeting. It is now 7 o'clock. We are going to begin our meeting just administratively. Member Kevin Davis will not be with us tonight, and Gino Fratelloni should be joining up in just a moment. But we do have 3 members here, so we have a quorum, so we are able to open our meeting and begin our process. Before we get started, anyone have any pressing issues that we need to address prior to our first public hearing? Seeing none, I will be honest, I'm trying to pause just for a moment to give Gino an opportunity to join us before we get into this. So I apologize, I'm speaking a little bit more slowly than a normal New Englander would be speaking, but... All right, we're going to begin. So our first public hearing this evening is for 30 Mill Lane, a variance request requesting approval for an impervious barrier. We have... Check it out. Oh, there we go. Thank you, Doug Lees, for the petitioner. Doug, you should have a panel. There we go.
All right. Hello. Can you hear me?
We can hear you, sir. Welcome. So you're here for 30 Mill Lane?
Yes, 30 Mill Lane. This was a septic system. My name is Doug Lees, by the way, from Land Engineering and Environmental Services, of the engineer and the surveyor on the project for M&B Investments, LLC. This is a septic system that was approved. We were in front of the board for a variance. The system is within 10 feet of the lot line, so there's some grading that takes place within 10 feet of the lot line. The system was put in as designed. The house was, there's conservation associated with the house. We had a notice of intent and an order of conditions, and during the conservation review, the house got slid about 6 feet closer to the septic system, and it was supposed to be raised, but that didn't get reflected on both plans, so it was put in a little low, making the grading between the septic system and the house a little difficult, challenging. The system is 32 and a half feet from the house and 10 feet from the lot line. But because of the grading out there, we're here tonight to put in an impervious barrier about 10 feet off the edge of the system, or actually 10 feet off the edge of the system, to allow the grading to take place without having to backfill and kind of burying that side of the house. So that's the history of the project. It was when the house got slid over during the conservation review and got raised, that didn't get reflected on the septic plan. And when the system was installed, the house was put in actually a little bit lower than on the septic plan, but pretty much as the septic plan goes. So it ends up being a little bit low for the grading that's out there.
Okay, before we go to Jim and Francis, I just want to clarify the timeline. So new construction, new house, new septic system.
Yep.
Went before conservation, went before us, got approved. Conservation
Correct.
Then said, we have a change in plan here. We think this needs to be moved we move 6 feet. And then the plans were never updated and gone back through the approval process. I think Doug froze.
We froze. I think I froze, yeah. Sorry.
So I just want to get the timeline straight for our sake of going. It sounds like plans went through, plans changed, plans never came back through the approval process.
The plans got changed at the Conservation Commission, yes.
After the Board of Health approved it. And there was no change to the
septic system. Right. It was just the house slid over 6 feet and raised, which really wasn't going to affect the septic system, except for in the field, the house didn't get raised.
All right. Gotcha. All right. Thank you, sir. Before we go to the board, we can go to Jim or Francis, whoever feels most comfortable chatting about it. Tell us a little bit of the side of their impressions of the plan, and we'll open it up to the board and the public.
So I did the inspections on the site, reviewed the plans, and when they were installing the system, unfortunately the lot slopes up towards the house. So it got to be even more critical when the house lit a little closer to the system, because the grading, that the standard Title V grading going out 15 feet level, sloping 3 to 1, got a little difficult in that you'd have to grade right into the cellar wall. And since the system's already uphill of the house, that was going to leave no place whatsoever to do some surface grading to get the runoff to go around the house. So one of the solutions, since both were in place and you can't really move the system, it's where it needs to be, was to come out with a impervious barrier at 10 feet and then slope it 3 to 1. That gave them the room to actually do the grading they need to do around the house to make sure the water can move around the house and not flood the basement. 10 feet, 3 to 1 still complies with Title V. They allow the use of an impervious barrier. Your regulations require that the board approves any walls or barriers at a public meeting, and that's why Doug's here.
All right. Thank you, sir. We're going to open up to the board. We'll do alphabetical tonight. Kevin Baker.
I guess I'm curious, without seeing a plan, I'm curious how that 6 feet, it's 6 feet on the elevation. That was missed, correct?
No, the house moved 6 feet closer to the field. Right now, the house is 32.5 feet from the field, and originally it was designed at 39 feet from the field.
Okay.
So it's not elevation, it's lateral movement. It was about a foot in elevation.
Okay, and Jim, you think with the poly barrier, it'll solve the problem and no adverse effects to public health?
I don't believe it will, no, and it'll make the grading around the house much better.
Okay. Yeah, no further questions.
Thank you, Mr. Baker. Mr. Wason.
I have no questions.
All right, and no questions from the chair. I don't see any hands in the audience. Is there anyone in the audience at the moment who'd like to speak on 30 Mill Lane? See no hands. What is the will of the board?
I'll make a motion to allow the use of the poly barrier.
I have a motion
All second.
and a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Matt Wason.
Matt Wason, yes.
Dan Kane votes yes. Good luck.
Thank you very much. Really appreciate it.
All right.
Thank you.
Have a good night.
You as well. Thanks.
All right. Officially, my clock says 7:09. We are 1 minute ahead of our 7:10 hearing. So we're going to actually pause for a moment. I do know that our friend Judy was working with Gino, trying to help him join our meeting. I have not seen him yet. I do not see him in the audience. We're officially waiting for 7:10 for our 9 Birch Road public hearing. Is there anyone in the audience to speak for 9 Birch on behalf of the petitioner? Thank you, Mr. or Miss McKenzie. I'm going to promote you to panelist.
Good evening, everyone.
Good evening. All right, we are now at 7:10. We're going to open our public hearing, for 9 Birch Road, Littleton, for a variance request for local variances and local upgrade approval for retaining wall and fill requirements. Ms. McKenzie, whenever you are ready, if you'd like to share anything you have and tell us the story.
Yeah, is it possible for me to share my screen?
You
Looks like
should
I
be able
can.
to.
Yeah.
Yep.
There you go. Hope you can see that all right.
We can.
So the property located at 9 Birch Road here is getting a septic system upgrade. It's an existing 2-bedroom house. We've designed a Presby system located in this area and show the breakout grading coming out with a small retaining wall, basically those 2 by 4 blocks, the concrete blocks, right basically along the property line, about 2 or 3 feet off. I think it's 3 feet off of the property line. There'll be a new septic tank being installed over here, a 2-compartment, 1,500 gallon, to a D-box to the leach area. The grading ends up all coming very close to the property line. We are requesting a couple of local variances and a couple of local upgrade approvals. The variances, and I'm not too sure about this one after reading it. I don't know that we really need a variance for regulation 23 because regulation 23 basically says that we need to notify abutters if we ask for a variance for a wall. So we have it listed here. If a variance is needed for that, then we're asking for it. But I maybe defer to Jim on that if he thinks I'm correct or not. But regulation 27 is regarding the fill requirements. No portion of fill requirement for a subsurface system shall be within 10 feet of a property line. The proposal shows about 3 feet for the wall and the fill to be ending right there. So we're just right off the property line. A couple local upgrade approvals. Reduction of system location from a cellar wall. 20 foot's required. We're showing 13.4 feet right in this spot right here. And then the second Title V local upgrade approval is for the reduction of the 4-foot separation between the water table and the bottom of the leach area. We've designed a Presby system, so that allows us to ask for a 2-foot reduction and a 2-foot separation at the end once you reduce by 2. So we're asking for a 2-foot separation from the bottom of the leach area to the groundwater table. And Jim can talk on this potentially. I guess he spoke with a couple of neighbors that were concerned about the proximity of the wall and the fill to the property line. So we've looked at, an alternative setup, and certainly I'd be happy to show that to you. But I want to advise you, we'd still be basically asking for all the same variances. It's just going to reduce down that distance from 3 feet to, I think, Jack said about 8 feet or something like that, or 7 feet of an offset. I'd be glad to show that to you if you're interested in seeing that. That's this layout here. So basically this involves a poly barrier being installed. The original plan does not have a poly barrier, about 10 feet off of the system, located right here. And then that would be followed with a 3-to-1 slope as required by Title V, but we would do a rip-wrap slope there to help prevent any runoff from coming down and potentially going onto the abutting property. But again, you're still probably, I think this is about 7 or 8 feet right here. So we still would need the variances that we're requesting. It just wouldn't be for quite as much, I guess. And I think that's about it. Yeah, there's no wells in this area. It's all serviced by town water. And that's what allows us to go for that 2-foot separation.
All right. Thank you, sir.
Mhm.
I'm going to ask Jim or Francis if you'd like to speak to it from the town side of things, your opinions.
Sure. So again, I did the testing and review. This is Birch Hill is pretty steep in this section, and so this property slopes right down to the abutter's property. The engineers have tried to use all of the tools that they have to try to minimize the height of the mound and the grading. So as Chris mentioned, they are asking for the 2-foot groundwater reduction. They're using a Presby system so they can slope the bed to try to follow the contours, the natural contours. But even doing all of that, they'll probably end up having to raise the grade a couple of feet from about the system down to, in this case, down to the wall, and then the other design. The barrier would be there and it would slope off a little more quickly. We had a couple of abutters, I should say. I had a couple of abutters come in and talk to me yesterday afternoon. One lives kind of kitty cornered to the right. The other one is directly downhill of it. And they were concerned about the potential for runoff onto their properties. So after I met with them, I contacted the engineers and I said, is there something we could do to try to minimize the amount of fill so we can pull it back from the property line? This design that's up there now, has kind of the standard Title V breakout requirements. So it goes out 15 feet, slopes 3-to-1. Just to be able to catch the fill before it goes over the lot line. That's why they need that wall. The other design that Chris had up there has the barrier on that out at 10 feet, still allowed by Title V, and then the 3-to-1 slope. And the goal here was it pulls the fill back from the property line a little bit, but also using the riprap, hopefully that allows any of the surface water that's coming across that maybe to go into the ground before it goes across the lot line. Regardless, I think, of what happens, unfortunately, the regular slope of the land, the water's going downhill. With this design, just trying to mitigate any potential from what the system may, any additional that the system may cause. I can't imagine it would, but part of the problem we see, and we've seen it really badly this year and last with all the rain we've had, the ground's so saturated, there's no place for it to go. And so using the riprap allows it to kind of get back into the ground. It also allows it to get back in the ground during those problematic times, like late winter when the ground's frozen, but you get a couple inches of rain. In those kinds of situations, the water usually just sheets downhill. This way here with the riprap, hopefully it'll slow some of that down and put it back into the ground. And just to kind of address Chris's, that regulation 23 is not so much a variance, but a kind of a direction for individuals when they're using barriers or walls that they have to get them approved by the board and notify the abutters. So it's more of a process regulation than it is a variance for it. So.
Right. So I don't think we actually need a variance from that because we've met those requirements.
All right. I'm going to open up to the board and then we'll go to audience for any public input. Pause one moment. I'm just going to bring Gino onto the panel. All right. We'll do reverse order this time. Matt Wason.
So I guess I think my only question is any other place on the property where you could put that field? It looks like it'd be uphill if you went to basically the northeast corner, but is that a possibility with pump to get it up there and bypass the issue altogether?
Well, we try to avoid a pump situation whenever possible. I don't know that there was no test holes dug up there. I don't know what the site conditions were that produce this. Either way, you're still going to end up most likely with the same kind of system. I don't know how well that would fit up here and still meet property line and building offset requirements, as well as the grading that would be required. You have to worry about what's going to happen up against the house at this spot. If this grade continues the same way all the way up and you put a system up here, the breakout grading now that we show down here is going to be actually up against the house. And so we'd end up having to create some kind of wall or some ugly thing along here to create that barrier so we weren't putting fill right up against the house.
And then in reducing the distance off the house and the cellar itself to the system, is that something, and maybe this is a question for Jim, is that something where you'd say, should we put a poly barrier there as well, or we're not worried about it because of the grading?
Just get on. I think in that case there, the Presby bed sloped. So we'd expect that the flow of that underlying wastewater is probably going down to the end of the bed and down towards the barrier. So I think it's less of a risk on the uphill side.
Okay. And then do we have any wetlands information?
Don't believe there are any wetlands in the area.
Okay, right. Okay.
Yeah, the lots surrounding are all built on.
It's all
Okay.
built.
Cool. I think that's all I have.
All right. Next, Gino Fratellone. Welcome. Any questions, comments, concerns about 9 Birch Road? All right. I'm going to come back to Gino. Kevin Baker.
How you doing? No, at the moment, no. I think if they're looking for the
I'm not sure if that's just me or is everyone else having Gino kind of garbled? Okay.
He's breaking up.
Safe and everything, and
I have no questions.
for the health, they were
Thank you, Mr.
checking
Baker.
it out.
I'm sorry, Gino, you're very broken up, so we really couldn't make out any of that. I apologize. All right, at the moment, the chair has no questions. I'm going to give Gino a moment for his system to catch up. And I'm going to go to the audience and we'll come back to Gino. Is there anyone in the audience who would like to speak to 9 Birch Road? I have a hand. I'm due to promote. So Stephen Foss's hand first. I'm not sure who came first. Oh, okay.
I got it. Hello, my name is Tess Deegan. I am the direct abutter on 1 Birch Road below the system. My house is situated about rectangularly downhill. And I just wanted, I did come to speak with Mr. Garaffi yesterday and our neighbor, Steve and Sarah Foss. I just wanted to reiterate that I already have a lot of water coming into the east side of my house from the hill straight down. It enters on the eastern side and fills my basement partially and then other areas also. I just wanted to mention that I hope any solution will not increase that amount of water. That's kind of my concern, obviously. And yes, thank you so much.
Excuse me.
All right. Thank you, ma'am. Stephen Foss.
Hi,
Good
Stephen
evening.
Foss,
Welcome.
4 Cedar Road. Yeah, I'm the adjacent butter. Anyways, I'm looking at the 2 plans. Well, first of all, I'd like to say thanks to all you guys for putting your time in for the board. It's a really worthy thing to do. Thanks. But I'm looking at the 2 plans. I've got some experience with this stuff, having been on the board. I kind of like the plan with the barrier and the riprap. I think that's going to collect the stormwater before it gets down to the Deegan household, more so than the wall. That's what I see, and I figured I'd just put my 2 cents worth in. Again, thanks for everything. I appreciate what you guys do.
And thank you, Jim, for suggesting that.
Yep. Over and out.
Thank you, sir. All right. Mr. Baker, go ahead.
After hearing the comments from the abutters, I'd like to suggest a riprap swale on the property line that directs the water out to Birch Road and into the storm drain in the street.
Any thoughts from Chris McKenzie, our engineer? We certainly hate shifting water out into the street as well, but
Yeah, I would be a little concerned.
This whole neighborhood, it's the whole lake neighborhood. It's lots of water and not much space, and all the water has to go someplace. And unfortunately, it tends to be in everyone's basements in that neighborhood.
Yeah, I would be a little concerned about putting a swale in, directing water going anywhere that isn't already going. The system that we're proposing here, other than the riprap part of it, will all be returned to loam and seed and lawn, and it's required to stay that way. You're not allowed to grow trees or anything like that on there. So the ground in the end is going to act a lot the same as it does now. There's not going to be any significant increase in flow off of the property because of this. the same amount of rain is going to be falling on the same amount of area, and it's going to be soil that's equivalent to what's there now. And actually, in a sense, there's going to be more fill there and more sand and more area to be able to absorb that water underneath. I don't know that I would be too inclined to talk about a swale. And putting a swale in here, you're going to actually have to do some serious excavation, because the hill, the way the slope comes down in this area here, is a high point on the property, at the property line. So the best you could do would be to swale maybe half of it in this direction. The other half is going to go over here towards Mr. Foss's property. And I don't know that he would appreciate that. That's my feelings on that.
All right, Mr. Fratelloni, is your internet connection a little bit better now? Are you with us?
Thank you. I can hear you very perfectly. I had a problem, and somebody came and they gave me a hand. And like I say, everything that I hear, it's fine. And thank you. Thank you. You don't have any problem.
All right, thank you, sir. I have no more members of the audience. Any other questions from the board or any input from our professional staff? If
I guess,
nothing,
Dan, I guess I would
Jim.
just say that to the idea of a swale, that's a steep part of that hill there, and I'm not sure where the catch basin is, but the idea of the riprap there was hopefully to slow that water down and try to get it to go into the ground back on the lot itself.
Right.
So I just would be a little concerned with what happens in the wintertime if we direct that water out that way.
Yeah.
Because I'm looking at Google Street View at the moment, and yeah, it looks like it's downhill steep. The nearest, what I can tell on Google anyway, is a full house length down on the opposite side of the street, and the houses across the street are also downhill both ways. They're downhill, but then also if you go straight across from one driveway to the other, it's downhill across the street as well as down the street. So anything we push towards the street is going to end up in those houses and on that street. And yeah, certainly concern about ice would be concerning as well. I do have Mr. Foss has spoken, but his hand is up. So Mr. Foss, go ahead, sir.
Yeah, Steve Foss again. Yeah, that's the discussion about moving the water out onto the road is definitely a negative impact for the neighborhood. We want to keep any stormwater from getting into the lake. That's what's causing it to go further into eutrophication. So again, the riprap's a good idea. If I were to do anything, I might even suggest a trench on the other side of the riprap towards the property line, if you will. But I think the riprap's going to do what we're hoping happens. Just my 2 cents. Over.
All right. Thank you, sir. All right. What is the will of the board for 9 Birch?
I guess one last question for Chris. So this revised sketch that you're showing, is this a final enough plan that we could potentially vote on it, or is this still a mock-up that you need to flesh out a little bit more? Like, is that exactly where the poly barrier is going to be, or are we going further in one of those directions?
So what you're looking at here is basically a clip of the plan as we currently have it. So this would the plan view of this would not change. Our actual final plan would have to change that we've submitted because it comes with title blocks and details and all that other kind of stuff. This was just produced for tonight's meeting to show what we could do. But we could have this plan ready and over to Jim quite quickly, as shown right here with all the proper details. Jim's going to want a detail of the poly barrier, I'm sure, and maybe something of the riprap, showing a detail for construction purposes, really. But yeah, it's otherwise ready to go.
right, what is the will of the board?
I'll make a motion to approve the plan with the poly barrier and the riprap.
I have a motion.
Would you mind amending your motion to include local upgrade approval on setback from the cellar wall?
So moved.
And the 2-foot offset.
So moved.
I'll second that.
I have a motion and a second. Roll call vote. Kevin Baker,
Kevin Baker votes yes.
Gino Fratelloni, I'll come back to Gino. Matt Wason,
Matt Wason, yes.
chair votes yes. Gino Fratelloni, sorry, Gino, if you voted, we couldn't hear you.
I say yes.
Thank you, sir. All right, the local upgrade approval and variances have been approved. Good luck with construction.
Thank you very much, and we'll get a plan right into Jim, and it'll have the revised offsets too for the final numbers there. Thank you very much, you guys.
Perfect.
Have a good night.
No, thank you very much. Work with Jim and Francis, and obviously if they have any questions and concerns, they'll direct you back to us. But good luck. I'm sure it'll all work out.
Thank you very much.
All right. Thank you all. All right, that gets us to our 7:15 discussion around the opioid settlement funds. As a little bit of background, we did talk about this a few months back. We talked with the assistant director of Elder and Human Services, and it sounds like they had a process. They had actually started working with the Substance Abuse Coalition and a few other folks. Upon follow-up, there's actually some miscommunication between us and them, and they actually thought we were taking lead on that. We have seen Francis has started some work putting together a proposed list of stakeholders here in our community to pull together and start having those conversations about how best to utilize that funding. So I'm going to, if it's acceptable to the board, let's start with Francis for the discussion, if that's okay.
Sure. So in your packet, you'll see, as Dan mentioned, potential stakeholders, and also a draft kind of survey for the public with some ideas on it in terms of general funding areas to look at. I bring it to the board tonight for just to open the discussion, give it some further thought for a future meeting. We'd also bring it to the department heads as well, such as Liz's department would have their certain expertise that they'd be able to provide input on. So I just open it up to the board for initial thoughts.
Pulling it now. It was not in our full packet. It was a separate email under a separate cover. So I'm just pulling it up at the moment. We'll share it with the group. All right. So as far as stakeholders, we have obviously our public schools. Let's just say the senior center, Elder Human Services, really, police department, library, Parks and Rec, Elder Human Services, our churches here in town. Learning Experience is one of our preschool and Murphy's After School Care as part of our early education and after school folks, and Oak Meadow as educational.
So these would be more of outreach for like providing paper copies of some kind of survey, so we get a larger group of the public to participate, not necessarily just people who live, but also people who work. And yep.
No, I apologize. I was one page too early. So we have the health department and the public health department and the board of health, the TA's office, Elder Human Services, police, fire, Parks and Rec, school department, Elder Human Service director, town clerk, community members. looks like a pretty good starting point. Obviously, if anyone has any other ideas or input, please share them either now or in the coming days, so we can start building this group and identifying opportunities to bring us together and start identifying where our needs are, where we can start focusing on what next steps should even be. We're very basic here of what even our needs are. I'm not sure we have solid numbers as far as
We do not. Yeah.
we don't have as far as recreational and misuse numbers overall in our population, exposure numbers. I'm not sure we even have that kind of data at this point. I haven't seen it. So yeah, it's kind of square one even here for background data. Never mind, we don't know what the needs are, so it's hard to develop an implementation plan if we don't even know what our needs are yet. So
Yeah, the initial approach I'm looking at is more of an emotional, contact through family members or friends in other towns, basically. I should have sent the board the numbers. The numbers are low. I'll send those numbers out to the board. There's some data. It's very scant. We have about 1 death a year and a handful of emergency responses, but it's very low numbers in comparison to other towns.
I know we've shared it in the past. I will try to pull it back up again unless I don't remember seeing it here as I look through this document. There is some flexibility in how opiate settlement funds are utilized. It is relatively prescriptive and limited of what we can do with it, but it is still also in some ways relatively flexible. So it is not only for opiates, it really can be for, any drugs of abuse. It can be for criminal justice side diversion programs. It can be for avoidance. It can be used for treatment programs. There's a wide variety of things around drug use and misuse that we can really utilize it for. So it's not purely for heroin and fentanyl. It can be used broader than that. So it is still relatively limited, but we have some more options. So even if our opiate exposures are relatively low in town, there are still other places where we may utilize it, as well as working with other communities, perhaps to leverage some of that money to find a bigger impact. So
Yeah, that would certainly be one of the starting conversation points, is looking at a regional approach versus a local approach, or perhaps a combination of both. I actually went to a meeting today with Neshoba for a couple towns that got together and discussed what fund spending could be pooling looking like, and some kind of general ideas of how that would work, and forming some kind of agreement in terms of how to spend that money over a certain period of time. We're not any further or any behind any other town in terms of looking at settlement funds and starting to build. So I think we'll find more information. I'll have more information available as the towns surrounding us start to look at their suggestions as well. The thing I like about forming the task force early on is it can be looked at more, not just with substance abuse, but also mental health and wellness as well. So any future programming like the community health assessment, we'd be able to tie in that group as well and kind of build that coalition. So it'd be great to bring everybody together like that. And I'm sure we'll build upon this a lot. And just start the conversation tonight.
all right. No, thank you. Questions from the board? Mr. Wason?
What is your timeline plan for your survey?
I think it's good to get it out there early. We're kind of at a terrible time where school vacation's coming, for the summer rather quickly. And at the pace we're going to be able to go, it's going to be a little tricky. I would like to get some stuff before the summer, but I guess we kind of have to see where we are in 2 weeks and evaluate how we can do that. And then participation period, that will probably take a good 2 months, maybe 3 months tops, to get enough back. So, we have to get a certain percentage of the population to respond to start collating data.
And do you I saw the program suggestions are within the questions. Are you asking about those programs in the survey to say, can people rank them, or is that just informational?
It's more informational to get their mind going. So at the beginning, I asked some general questions, and then I threw out some ideas and some subject areas to look at to get the mind going. And then I've had some open responses. So then you get some more personalized responses to build on. It's just kind of how the flow I saw it starting. There's a couple different ways we could do it. We could do based on priorities in terms of areas, or we could just do in general what do people focus on most and care about the most in terms of program.
Yeah. I like it. I think since you're sending it out, I don't know if there would be any harm to
I'm gonna
ask
bring you
as
that.
well. What
pretty
you know, what
soon,
do you
okay?
think as a community member, which should be our priority? Otherwise, it might be a missed opportunity if we don't ask the question. Then, like you said, if our numbers are low, that's a positive. That's good. I like that. But people also might, I don't know, have some more inside information or community information that might say, well, yeah, but maybe this one is a little more important for somebody who knows the community well.
Stigma plays a large factor still too. So it's going to be opening that conversation because it'll be to also, community forums as well. I think that we'll end up having. So it'll be interesting to see how it transgresses over time.
Thank you.
Thank you. I said for my piece, I wouldn't necessarily hold off just because school's coming to a close in a couple months. That, there's still lots of good work we can do. We obviously need to include that big a population and a data source into our piece, but I wouldn't necessarily put everything else on hold simply because summer's coming. We can still start the conversation, start the process, and then ramp up as folks coming back in September if we get that far. But yeah, I wouldn't necessarily put things on hold until September just because school's coming to an end, because there is still school staff working through the summer. So, and there's lots of almost everybody else on this list is working all summer. So we might as well still start the process. Mr. Baker, go ahead.
Yeah, I just want to say thank you, Mr. Daigle, for putting that together. I think the survey is great, and maybe we can use the end of the school year as a benchmark, but a date by when we'd like to get this sort of out into the community and hope to have responses by, as opposed to waiting till September to put it out there. So maybe if we get some folks that are responsive, police, fire, Liz at EHS, and some other members of the committee, we can get the ball rolling sooner than we think. Do you think that's possible?
Oh, absolutely.
Okay.
Yeah, I'm going to try to go full steam ahead. So
Nice.
do as
Let
much as we
me
can.
know what I can do to help. Happy to be there at the meetings. Let me know when you need me.
Oh, that was great.
Thank you.
The next step for us would also be to think about how we promote it, how we get it out there. I'm fairly new to the town, so I don't know all the channels. Marin in planning gave me a great list of resources to get public information out broadly, but if the board has any suggestions, always open to that as well.
Mr. Baker.
I just have two. One is Liz at Elder Human Services. She's got the broadcaster newsletter that we can put out, and I'm sure she's got a digital database of some sort. And she also has that Facebook page that she manages really well, and it's got a number of followers. And it might be a really good place for us to put something like this out to get the word out. And then the other group is public schools.
Yeah.
And Dorothy Malone is amazing. And she's got the mailing list, and that's pretty much all we need. And then there's Parks and Rec. They also have a really, cast a wide net with their marketing and advertising. And I think they're right upstairs from us now. So I'm happy to go up there and talk with those folks next time you and I are in the building together. We can do that.
Yeah, of course.
If we were ready, town meeting is 2 weeks, right?
2 weeks.
Could we get something with a QR code? Yeah, May 11th. Could we?
I'm figuring it out. Yep.
Maybe we get a QR code and just distribute that, as people walk in, because there'll be people handing things out right at the door.
Or paper copies. Fill it out and drop it off right there.
True.
Yeah, the nice thing about the money too is we can also use it. So I went to a conference on I think it was the 18th and 19th, where they had updated information on the settlement fund. So you can use it for like getting feedback. You could give gift cards. You could pay people to be part of things. You can incentivize. Those are allowance for the funds. So that will help as well too.
Great.
Speaking of town meeting, it looks like that one of the items, I forget which warrant item it is that, yes, part of the budgetary process is moving the settlement fund, which by state law goes into the general fund, into an enterprise fund, basically, or a separate line item out of the general fund, so that it's a little bit more easily trackable of what's in it, where it goes under a single line item rather than in the general fund. So that's on the warrant. I forget where it is on the warrant, but just basically it's putting it into its own box so that it's more easily tracked. So if anyone asked if you see that on the warrant, that's should be what that's for. It's simply a tracking process out of the general fund into its own.
And right now we have about 96,000 in the fund that's been submitted so far. We'll probably end up a little over 200 depending on where CVS lands.
Okay. Well spent. That could do a lot of good in our community. So this is good. Hopefully we can really focus on some reasonable cost, high impact programs to make a difference.
Absolutely.
All right. Thank you for all your work on that. Thanks for the discussion. I have no one in the audience. So if the board's okay, we'll move on to our next item. We have a 7:20 discussion around Board of Health public toilet or portable toilet regulations. It does mention discussion and vote. We will not have a vote tonight since it is listed as a discussion, not a public hearing. And I'll be honest that we did not have any updated portable toilet regulations in our packet that I saw, unless I missed them. Certainly may have. Nope.
It's in the packet. Francis sent out that includes the opiate settlement
Our
stuff.
other packet.
Yeah.
Packet. Sorry.
The director report.
All right. Well then, Francis, it's all yours. Tell us a story about portable toilets.
So exciting. Wasn't really consideration, but we recently learned that the carnival is coming to town in June. So part of that will be porta potty placement. People are asking about permits. Placement is such a big event that hasn't happened probably in 60 years. It kind of seemed like a good item to have on the books in terms of maintenance and placement. So this is a pretty boilerplate for the board to look at. It's not meant to be voted on tonight. That was a misprint. We would do it as a public hearing if the board wanted to go forward with this regulation for our next meeting.
Mr. Baker.
I think it would be great to just have something in place. And it seems like this is pretty well done. So, yeah, you have my support.
Quick question, Francis. Are the red areas changes from an original or something, or do we need to pay close attention to those?
I just highlighted those because those could very easily change and what we'd be really focusing in on. These are the most commonly used. So I just highlight them to make it easier to go through and read.
I'm just doing a quick skim through as well. So like right now in section 4 operation, no more than 5 days in any month. If locations out below. I'm just getting, so for example, we usually have portable toilets at Fay Park all summer, for example. So under, it's a municipal site, public facilities, it would be exempt from that 5-day requirement, it looks like. $25 offense. I'd have to go back and look at our fee schedule. Is that consistent with our enforcement schedule for other violations?
I think we charge a little more than 25, but the form is not really in use technically from what I understand. So it gives the board the chance to make a decision whether they want to set a different fee anyway.
All right. Any first pass questions from the board? Otherwise, we can review and bring forward to our next meeting on. You guys will be faster than me, probably. Should be April 8th. Excuse me, May 8th. All right.
Sounds great.
Absolutely. We love I'm not a big one on rules, but I love having things clear so everybody's on the same page. So this is good. All right. That gets us to if I don't see any other hands, any other questions around portable toilet regulations, it gets us to our 725 Board of Health model regulations for private well discussion. When last we talked, we were still waiting for some feedback from some interest community members as well as our agriculture and agricultural commission friends about some input from their side. Mr. Baker, I know, was taking a big point on this. Kevin, did you have anything more to share, add any updates, or Francis or Jim?
I did not have any further updates. We were at the point to where we were going to sort of separate it out and look at it piece by piece, separating out the new construction versus existing construction. And I don't know if we have separated it out like that. I know we were going to take out the geothermal wells out of that piece, and we did finalize that there is no definition for an agricultural irrigation well, so we might be best served coming up with one and putting it into our own document here.
I can bring a more finalized version to the next meeting, kind of playing out what areas that we could look at to approve that night and areas that might need more consideration going forward before we approve.
That'd be great.
Mr. Chair, the geo wells, is there a reason why you're not considering that? Just because we're seeing lots and lots of applications in other towns for geothermal wells, primarily closed loop?
I'm not sure if we have necessarily. I think the separating them out was separating them out between potable water and the geothermal was the only reason to separate them out. I sort of think we could probably do a geothermal portion of a regulation relatively easily. Mm-hmm. Whatever our technical offsets are simply for construction reasons, and offsets from, whatever the distances are off from gas lines, water lines, septic, just simple numbers, and a classification that there is no interconnectedness into any potable water system in the house. That, again, that's not a bylaw or regulation, but that's not far from it really for that kind of a system. You have to be at least this much offsets from property lines and houses and other pipes, and you can't connect it to potable water. It seems pretty straightforward. It was really trying to separate it out. That's an easy one. It's how do you address what's agriculture, what's potable, what's geothermal. But as a subsection, it seems geothermal really is the easiest. As long as it's not connected to potable water, pretty straightforward. I think probably the more challenging one is how do we figure out what is potable water versus irrigation water, and how do we make sure those two things don't necessarily ever mix? No, it's the water in my yard, and then 10 years from now, oh, well, I can just connect this up because I've got this well, and has kind of missed some of our initial testing in those pieces, and I think that was how do we classify, how do we look at agricultural well watering my lawn versus potable versus both in my same yard. How do we clarify all those pieces and just make sure that it's clear and we're treating them all appropriately for their intended use and making sure that their intended use doesn't change. I don't want to say downgrade, but if I've got a potable water well and I get water in my street and I decide to connect, I can still use the potable water, or I can use it to water my lawn. It's turning my potable water into an irrigation well is really, again, I don't want to say downgrade, but as far as we're concerned, great. Have a great time. You have nice clean water you put in your lawn. I'm not worried about it. It's when we move the other way that water might not be considered potable that's now being connected into a house and is being used as potable when it was never tested or inspected that same standard when it started. So, Mr. Wason.
Question for Jim. I don't think I've asked a hard question yet tonight. How do potentially swimming pools come into play with your water source? And I'm not necessarily thinking the large in-ground pool with chlorine treatment and pumping and stuff like that, but smaller above ground pools with more static water or wading pools or something like that in kids. Is there any sort of guidance for your water source for those types of usage? Or is it nobody will ever drink it, so it's fine?
I don't know that I've ever seen a set of regulations that include considerations for pool water, because generally I think they're going to be filtered and treated. Even some of those small ones that you see that they go to Walmart and pick up, they may be 3.5 feet high. I think they even come with filters. So I don't know that there's any, from our standpoint, you'd want to make sure I didn't leave the hose in it so it wasn't a cross connection, particularly if you're tied into town water. But that's kind of where we come into that.
Okay.
All right. So follow-up plan is going to be Francis is going to take a look at where we are with the model regs with some of the input we've already kind of gotten and looked at and made some adjustments to, and see if we can even do not necessarily implement, but at least review and approve portions of other regulations so that we're closer to having it ready to go out as promulgated regulations from us. Awesome. All right. 2 weeks too soon? Need more time than that?
Pretty fine.
Yeah. Okay. So we'll put that on our May 8th meeting as well. All right. If there's no other discussion around wells, that gets us to our 7:30 infectious disease decision support tool. Dr. Wason.
There it is.
Oh.
Woo. Forgot I was next.
Ooh, a bump.
Okay, here we are, folks. We've come to an interesting point in our COVID history of all time, and that is there is only one variant in England, period. 100%. No other variants exist, which is just scientifically just kind of very exciting for me to think about, but I'm sure it doesn't excite most of you out there. But to see that one is sticking around and there's not a lot of changes going on that are producing a new variant is just interesting. So, but it's out there. We still just have some middling cases you see going on over here this spring, kind of a little here and there. The wastewater numbers are all pretty low. They've kind of stayed that way for a while, but not zero. So it's still out there, still circulating, still infecting. Our arbovirus data for Massachusetts is not updated yet, so they're still on the 2023 season, but I'm sure you're all seeing mosquitoes out there because I'm seeing mosquitoes out there. So as soon as that starts getting updated, we'll be reporting it here. Influenza for Massachusetts still remains at a moderate category, where our vaccination rate hit almost 52% for the season, which is a little lower than we'd like. And RSV, I'm going to drop down to low. As you can see, we're coming out of the RSV season, so that's good news. Respiratory infections are kind of down all over the place, so hopefully it's a nice spring here, and the mosquitoes all die from the frost, over the next last week and this week, and it'll be a great season for arbovirus too. That's what I got.
All right. Thank you, sir. I will share, certainly I know from our statewide numbers, the last week we had info for was April 7 to 13. There were a total of 575 new coronavirus cases in Massachusetts and only 4 deaths. I want to say only because even through all this, we've still been, 50, 60, 80 cases, 80 deaths. So the last couple of weeks, we've actually come down quite a bit. So it's obviously 4 is still more than we'd like, but that's a lot better than where we've been, both new cases and deaths. So it's still out there, but a lot less. It's really, really good to see. So the anecdotal data, our hospitals are still kind of crazy, but certainly less consistently overwhelmed than they have been even 3 or 4 weeks ago. So certainly there are very, very busy days, but it is overall much better than it has been in a while. Still, utilize other resources when you can. Urgent care, primary care providers, telehealth visits, all those good things. Only go to the emergency department in the hospital if you really, really need to. But if you need to, obviously go. But yes, hospitals are in a better place than they've been in a while. So, any questions for Dr. Wason about our ID decision support tool? No? Okay. That gets us to administrative matters. I apologize. As I was pulling other things up, I did not pull up our minutes for 3/27/24. So if folks can give me a moment while I try to pull it up off of the OneDrive. Are there any other correspondence, member updates, or discussions that folks would like to have while I am trying to pull this up? Nothing. I asked a question of Francis and Jim about some new construction on Hartwell here in town, near kind of the wetlands on the low end of Hartwell. It looks like for a couple of them, that looks like the leaching field was in the front of the house, a good distance from obviously wetlands and pond. I did have a question about kind of the house setback a little bit, and I was wondering if Francis said he was going to go out and take a visit. From drive by, it looked like I couldn't imagine any part of that property was more than 100 feet away from the wetland, since the water was above and beyond the barriers and the little tubes by about 10 feet when I went by on that day. So, Francis, did you have a chance to go by? I'm sure it's all compliant. Just to make me feel better as someone who drove by and went, how on earth is any part of that property 100 feet away from wetlands?
I did, but Jim will have a better update because he was able to go back and look at the plan as well.
So I talked to Tim, the assistant conservation agent, and that water level in that pond has come up significantly, like all the water bodies in town have come up. And then that doesn't seem to have an outlet. So it really looks awful when you stand there and look at it. And when I was doing the inspection of the septic system that's installed, we were looking at the water table saying, hey, why don't we dig a hole and see that we're still the right offset to the groundwater. When we did that, we adjusted the height of the system. So it's actually higher than the original permitted plan because we found water table that was higher. Now, whether that's a permanent thing or whether that's, we had 50% more rain last year and we're ahead of rain this year, don't know. It's pretty well drained soil, except that pond is like the puddle at the bottom of the hill. It just sits there. And I think beneath that is water table. So the conservation didn't seem concerned about it. And, they're checking to make sure the erosion control, the wattles that you saw, were still being maintained so that they didn't get stuff into the wetlands.
Was there a 100-foot offset between the leaching field and that water?
So according to the plan, when it was originally permitted, there was 120 feet from the edge of the pond to the edge of the leach field. I'm not sure how much it's come up. Your regulations, I believe, talk about 50 feet from the leach field as an offset to the wetlands. I think that got revised. I think
100 feet treatment.
I think you changed that. There's a regulation that you put in that says if somebody's requesting a 2-foot offset within 100 feet of wetlands, they need to put treatment on it. But I'm pretty sure your regulations talk about 50-foot offset to the leach field. And it's 50 feet at a minimum, but the proposed plan showed it at 120. It's probably a little closer than 120 now based on where the water is today.
Okay. Kevin Baker's eyes are moving side to side. He's thinking. Anything, Kevin? Hold on. You're on mute.
I'd have to look at the plan. I drove by today and I was like, wow, he's right. That water's really close to the leaching field. It's like right there. It's like over the wattles. So should we have it flagged again? You know, is it a good flag? Did they put them in the right spots? Maybe not.
Like I say, when I talked to Tim, again, assistant town conservation agent, he didn't seem concerned at this point.
So conservation's not concerned under their piece, but
Yep.
Board of Health, should we be concerned under ours?
Again, with the offset being 50 feet to the wetlands, I think it's meeting the town's regulation.
So explain this to me again. Sorry. So it's within 100 feet of the wetlands.
So your local regulation for wetlands offset to leaching fields matches Title V. It's a 50-foot offset from the edge of the...
We don't have a local regulation. It just matches Title V.
So that's right. So
Yeah.
you put a regulation in for these upgrades where people were asking for reductions to the groundwater offset down to 2 feet. And what you stated in that regulation, if somebody comes in and asks for that 2-foot reduction and they're within 100 feet of wetlands, you ask them to install treatment tanks.
Right. So what's the groundwater offset on these?
These meet fully compliant. They're
4 feet.
5 feet because it's sandy
5
soil.
feet. Okay.
Right. And again, what we did when we were out there looking at them, we wanted to make sure, since the water table had come up, that it was still 5 feet above it. So we had them dig a hole, and we made adjustments based on what we found. So
Thank you very much. Sorry,
no, it's shocking to go by now. The trees are all gone. You look over there and say, "Oh my God!" Right, and you see the shed sitting in the pond, and you go, "Why is the shed sitting in the pond?"
I was going to say that usually, when you could see through the trees, was at the edge of the pond, and now it is in the middle of the pond. That yes, obviously we've had lots more rain, but that also means that anytime we have lots more rain, that conditions are probably going to be pretty similar to what we're seeing right now. So
again, I feel comfortable with, since we raised the elevation, that it's more than the 5 feet. It needs to be above the water table, and with your regulations not requiring the 100 feet, it meets Title V.
all right, no, thank you very much for going out and looking at it. But yet, I was just checking.
Completely understand. Completely. I think we're all kind of scratching our head, including the developer.
All right, so thank you guys for being patient with me. I have our minutes for 3/27. Let me share them. I can pick the right screen. Oh, Mr. Baker, go ahead.
I was just going through the minutes. There are a bunch of typos on there. I don't know if you just want me to correct them all right now with the spell check or because I've been running through it.
There are a number of typos. If the board is comfortable, I'm gonna table these minutes and ask Brenda just to go through and just look at all the squiggles and just address that, and then we can, if anyone has any input or edits offline as well, we can just bring it back a clean copy for May 8th for a review if that works. Because there are more than enough spell checks to deal with on this one. I think that I don't think we need to deal with that.
Yeah, I think
Here on
the
the
content's
agenda.
good. I just think it needs the grammatical stuff.
I'm happy to, if it's the board's will, to approve with the caveat of spell check. as long as there's no content errors. If it's just grammatical corrections or spelling corrections, I'm happy to accept either from the board, whatever their will is.
I would say we table it and just have it on the next one. It's not yet 30 days or almost 30 days. So we can 2 weeks.
We just got them yesterday, right?
Yeah, I think so.
Unless I missed them over the weekend, so I haven't reviewed them.
All right, so we are so Brenda and Francis, we're going to table these ones just to allow a little bit of cleanup on the minutes, and then we'll bring it back before the May 8th meeting for final approval, if that's okay with you guys. Any other correspondence, discussion, member updates for the good of the order?
I will just say that Kevin and I have been meeting with Francis, trying to get there once a week just to kind of keep in touch and see things going. And there's a lot going on. It's kind of exciting. This board doesn't have time to, review every single possible stone that's being turned over, but I really appreciate the work that Francis has done so far in such a short start. There are a lot of things in motion, and we're going to see snippets of it here and there, like portable toilet regulations, which is great, but there's work that has to be done to get those things done. So I just appreciate the direction we're already starting, and I thank Francis for jumping on board, and I thank Jim for supporting and continuing to build this relationship together. And good things are coming for the health department / Department of Health.
Thank you.
All right, thank you, Mr. Wason. And seeing nothing, I'll entertain a motion.
I'd like to make a motion to adjourn. There you go. I'll second it.
I have Mr. Wason with a motion to adjourn. I have Kevin Baker with a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Gino Fratelloni.
Jennifer will say yes. I think.
Matt Wason.
Matt Wason, yes.
And the chair votes yes. That concludes our April 24th, 2024 Littleton Board of Health meeting. As always, thank you all for all your work. Francis, Jim, thank you for being here tonight with us. Brenda, thank you.